Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy or you're just tired of not feeling like yourself, this space is for you. Hi, everyone. Welcome back to the Immune Edit. I'm Dr. Doug Jones. Today is a great topic because it is something I talk about every day, and it's so easily confused, but it's the differences between food intolerances, sensitivities, and allergies, and what are those differences, and how can we really tell the difference? So, what I've observed over the last decade and a half is if somebody has some kind of reaction to a food, they always want to throw any kind of adverse reaction or anything into the food allergy bucket. And I'm here to make an edit on that today because that's not great. First of all, we need to understand the differences between these things. If you're putting everything, whether it's a sensitivity, intolerance, or allergy, into just one bucket, that's almost like saying people who have had a stroke or seizures or dementia all have seizure disorder, for instance, throwing it all in the same bucket. We can't do that. They're very distinct, they're different. And just like that, with food allergy, intolerance, or sensitivity, we really need to understand what some of these differences are because the risk of each of these is different. And so if somebody has a potentially true life-threatening food allergy, it needs to be taken very seriously because of the risk that they have. Not that I'm downplaying the other things, it's just the risk is different. Um, it's one thing if a food is going to make you feel crappy, literally crappy, versus potentially life-threatening. That risk is just different. And so when some people have perhaps an intolerance, but then they downplay it and call it, or sorry, not downplay it, but if they have an intolerance and then they say it's an allergy, but then they downplay it to somebody else, that's not a good situation because that's actually kind of detrimental to those that have life-threatening food allergy because that has to be handled with caution and with care. Um, so what are the differences in these? So let's start with food intolerances. Food intolerances are often due to a digestive enzyme that may be lacking within the body or something within the digestive tract where we're not able to digest the food properly. And as a consequence, you can get some gas, bloating, often diarrhea. It's predominantly GI related. Sensitivities, on the other hand, can have very similar symptoms of gas, bloating, diarrhea. But this is one where you may not be lacking like a digestive enzyme. You may just have a sensitivity to a food where it's creating some inflammation within the body. And that can also cause gas, bloating, diarrhea. You can have some constipation with it. But also with sensitivities, you may have some other symptoms like brain fog, fatigue, joint pain, those kinds of things. So it may not just be GI related. It would be GI plus. Okay. Food allergy is one where it's triggered by the immune system, though. And that's the one where it can lead to a potentially life threatening situation. It's triggered by that immune system. There are a couple of different types of food allergy. There's one that we call, in broad categories, IgE mediated food allergy or non IgE mediated food allergy. Both can be potentially life threatening in different ways. Let me explain. IgE mediated food allergy. So, IgE is a protein or an antibody that our body makes, and it's very specific to the foods that somebody's allergic to. And so, it's almost like a lock and key mechanism where it's that lock and it's waiting for the key, meaning the food that somebody's allergic to, that exposure to unlock the door and create the allergic reaction. That can be, it can be mild, it can be moderate, it could be severe in nature. But I don't mean that as a static term. What I'm talking about is the type of reaction that may occur. The thing is, we can never predict what type of reaction may occur. So when somebody says, I have a mild allergy, that's really a not a great use of the word, or a moderate allergy, or a severe. In my mind, if you have a potentially life-threatening food allergy, it's severe, because I always tell people we want to be like the military, where we're not going to be prepared for most likely scenarios. We want to be prepared for uh, the most dangerous scenarios. And so, with life threatening food allergy, we always want to be um, best prepared for that most risky situation, which is anaphylaxis, or a severe allergic reaction. With anaphylaxis, there's multiple systems in the body that are affected. The skin can be affected. We can get hives, rash. Um, the lungs can be affected, where we get tightening of the lungs and wheezing. The throat can be affected, where we have swelling of the throat. That can be life threatening, because the throat can close off. The blood pressure can be affected, and that can also be potentially life threatening, because you can get severe low blood pressure, and that's another thing that can be life threatening. And so, multiple systems can be involved when somebody has a true IgE mediated food allergy. And what's tricky is, we can't predict the amount of food that may trigger that type of reaction, or if a reaction is triggered, how severe each reaction will be. And one myth is that with every exposure, the reaction gets worse. Not necessarily. That's a myth. You can have a severe life threatening reaction even after one or two exposures. Um, that's just the nature of it. And so we always want to be prepared for those worst case scenarios. Um, The other kind of food allergy that's called non-IgE mediated food allergy. One example of this is something that's abbreviated FPIES. That's like FPIES. It stands for food protein induced enterocolitis syndrome. That's a mouthful, which is why we abbreviate it as FPIES. But on this one, that can be potentially life threatening for other reasons, because these patients may get just severe vomiting diarrhea, to where their volume just gets depleted. And that can be very severe and life threatening to those patients as well. So it's a different type of presentation, it's a different type of history, but nonetheless needs to be we need to have that same kind of caution that's exercised with the IgE mediated food allergy. And so these are some of the differences. Now, even within food allergy, that just opens up a whole category of situations, because with food allergy, not all foods are created equal. They can all give perhaps a potentially severe life threatening food allergic response, but there's certain foods that, for instance, when this presents, it may present at a young age. And so with some foods, they're more likely to be outgrown. The food allergy may be, others may not be such a high percentage of it being outgrown. Um, we also want to think about, are there other exposures or cross reactivities? There's something called oral allergy or food pollen syndrome, where our body may react to certain fresh fruits or vegetables or nuts, but it's the proteins in those that look a lot like the pollen. And it's actually that pollen sensitivity, or the pollen allergy, that's kind of driving the symptoms with those foods. You can see a similar thing with latex, where there's foods that cross react when somebody has a latex allergy. There's also issues where somebody, if they have a nickel allergy, for instance, they may get a rash or upset stomachs or things like that with foods that contain nickel. And yes, there's a lot of foods that contain nickel. You can look it up. There's also things called alpha gal, where that comes ultimately from people that have allergy to red meat, but the source of that is from a tick bite, weirdly. And that presentation is a little different, but again, can be quite severe. So there's that nuance. There's also something that's called eosinophilic esophagitis, and we abbreviate that EOE. That has kind of a combined picture where it's mediated by one part of the immune system, but you can also have kind of that IgE mediated piece. And it's really important that you meet with your allergist and talk about that particular situation, whether it's mediated through what we call T cells or IgE, and really get a handle on that particular situation. So there's all kinds of just nuance that's associated with food allergy in and of itself. And some people will try to boil all of this down into like one test, or two tests, and diagnose everything. And that is just not the way to go about it. In an upcoming episode of the Immune Edit, we're going to go into some of the testings that may occur with food allergy or food sensitivity, food intolerances, some of the pearls and pitfalls of testing. That is a conversation by itself that will be upcoming. Other types of food reactions that people may have that may either go into intolerance or sensitivities is something called histamine intolerance or mast cell activation syndrome. You may have heard these terms. Some people question, are they real, or is this just made up? They are real. It's definitely real. I do think it's massively overdiagnosed and oversimplified. And you have to be really careful with these because, again, of the testing that's out there. And there's a lot of wellness influencers or function medicine type people that may try to take advantage of you in these situations with ordering of invalidated tests and then sell you certain supplements or try to sell you certain supplements that may or may not even be helpful and aren't really backed by evidence or science. So I just want you to be really cautious of those types of things. Um, so as you can see, this is a really big topic with a lot of different nuance to it. Intolerances, just to summarize, are primarily due to lacking of digestive enzymes like lactose intolerance. You probably heard that one. You have the sensitivities that have predominantly GI symptoms, but you can also have joint pains, brain fog, fatigue, those kinds of things. Allergy, on the other hand, you can have all of the symptoms and you can have even more symptoms. You can have lung symptoms, GI symptoms, cardiovascular, all of those things, and they can be potentially life threatening. So we have to understand the nuance of each of these and also the risk associated with them. And I want people to really make the edit of not putting every single adverse reaction that you have to food in an allergy bucket if it doesn't deserve to be there. So if you have questions on this, happy to, have some questions in the comments, leave the questions, message, make an appointment, do whatever, or meet with your local allergist to kind of sort through what do you really have or what does your child really have. And let's make those edits so that we're using those terms correctly. That's it for today, and I hope you have a great day. Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.